Hi, my name is Whitney McCoy and I'm with Home Care Assistance of Nebraska. We've been open in the region for about 10 years and have offices in both Lincoln and in Omaha. The reason we opened 10 years ago is the same reason we're still open today. Our focus and goal is to elevate the level of care that's accessible to our community in the home. So with our services alone, we're able to bring assisted living to the home. And when we partner with medical services such as home health, hospice, or partner intimately with a medical provider, we're able to elevate that level of care to nursing home level of care at home. The way we do this is through our care management model. So I'm a nurse and I was a care manager for 5 years prior to moving into this role. And care managers are really responsible for kind of being the main point of contact and the right-hand man for the family, the medical provider, and any caregivers on that team. We've got about 9 care managers between our 2 offices. Their backgrounds range from nursing to social work, gerontology. We even have one who's an occupational therapist. So they have tremendous backgrounds and training to be able to manage all of the care, supervise and train the caregivers, provide communication to clients, families, and medical teams, and then ongoing support and navigation with the families and clients through whatever condition they're working through at that time. The personal care that we're able to provide at home is elevated because of what those care managers are able to come out and help train for. So we'll help clients, whether it's a single client or a spouse, a couple, with any personal needs. So bathing, grooming, dressing, toileting, transferring, feeding assistance if that's required. And we can do this from standby assist, just to make sure that they're doing it safely, all the way to total dependence. So we'll help out with feeding tubes, wound care, catheter care, ostomies, and more. So really trying to break through that glass ceiling of, traditionally when people were told, you've reached this point, now you have to move out of your home. Because we're in the home environment, we also need to make sure that that's maintained. So we also help out with light housekeeping, transportation, medication reminders, and meal preparation. Now we can come out and do this anywhere from 2 to 24 hours at a time. It's really a conversation between that care manager and the family to assess each individual's circumstances and situation and make sure that we get the right schedule put together for them. Safety is the top priority, and so we want to make sure that we have a small, stable team that is trained for that family. The care manager has to green light everybody that comes into that house and make sure that everybody's comfortable and happy with the situation. There's a lot of confusion between home health and home care, the medical and non-medical entities. So we are the non-medical provider. Therefore, Medicare is not a payer source for our services. So private pay is one of the options. We also accept long-term care insurance. Something to look for in there is to make sure that it says it covers non-medical services. In the state of Nebraska, the providers do not have to be licensed medically. So even if the policy says that, it's still something that we can dive into a little bit more. And we'll handle all the paperwork and documentation to make sure that you get reimbursed for that. We also accept Medicaid waiver through the Aged and Disabled program, or AD waiver, also the child care waiver. So we have people, children all the way up to seniors that are on our care. And then workers' compensation is also an option, and then VA benefits. So if you're a veteran or your spouse was, then we can work through some contacts that we have to help you get those benefits unlocked. If you want to get services started, it's a very easy process. Again, because we're non-medical, you don't need physician's orders. So you, a family member, can just call in, talk to one of our care advisors, and we'll talk through your specific situation and see what's going to be the best plan for you. We'll match you with a care manager who will come out to the home and provide a free consultation. Takes about an hour. It's just a time for you guys to ask each other a lot of questions, get to know each other, and come up with the best plan for moving forward.